Hi, welcome to our lesson on breast cancer. This exemplar falls under the concept of cellular regulation, which is something you learned about in anatomy and physiology, where the cell is the basic structure of the human body and serves a specialized purpose in the body. It clusters and then forms organs. Those form organ systems, and that forms an organism. And it divides and dies at a predictable time. So cancer is a mutation of those cells where it no longer mirrors the parent cell, doesn't serve a purpose anymore, and unfortunately can spread to other parts of the body. So with breast cancer, this forms in the breast tissue. It's the second most common cause of cancer deaths in women, so it's fairly common, and you'll probably definitely see it at some point in your career. So these cells, like I said, they divide and they no longer serve a purpose in the body. Unfortunately, the location of the breast tissue is really close to those lymph nodes in the axillary area, so it can get into the lymph tissue and spread pretty easily that way. And like you can see here, it can also attach itself to the muscle and tissue underneath that breast tissue, and then maybe even get into the bones. So that's why the mortality rate can be quite high with breast cancer. And you can see we stage breast cancer just like we stage other cancers. So once it gets into that lymph and travels, that would be a stage 4, where it then attaches itself to other organs in the body and spreads. It's called metastasis. So being female is the greatest risk factor, although this can happen in men. So both men and women should be doing self-breast exams monthly, and then getting a professional breast exam yearly, especially women, but also men. The incidence does increase with age. Early menarche, which is that first period, and late menopause are risk factors, so a longer period of time of menstruation is going to increase the risk. Someone who's never, or a female that's never been pregnant, is going to be at a greater risk, and if that female's had a lot of miscarriages, that puts them at a greater risk. There is a genetic factor, and we can test the person for this to see if they carry this gene. It's called BRCA, and sometimes if there's a strong family history and they do have this gene, they may elect to go ahead and have a mastectomy prophylactically, just because they know their risk factors are so high. Lots of alcohol use, sedentary lifestyle, obesity, those are all modifiable risk factors. And then hormone use can also increase the risk, so that's why nowadays they're more hesitant to use hormones during menopause. Even though it makes the females usually feel better, it does increase the risk of breast cancer. So some manifestations. The first thing to look for, and this is what you look for during that self-breast exam every month, is any new lump or mass. And this is not, it doesn't feel like a cyst. So some women have fibrocystic breast disease, that's pretty common. But this type of lump is hard, and any size is concerning, especially if it's new. It's hard, it's usually immovable, and non-tender. There may also be changes in the breast shape or swellings on the affected side. Some skin changes, so we call this orange skin, where it becomes more rough and dimpled where that cancer is. And then any nipple changes, so a nipple inversion or discharge from the nipple, that can be a warning sign too. So we diagnose this through a mammogram, which is where they look at the breast tissue for dense areas. They can also do an ultrasound for the same reason, or an MRI. If they see anything suspicious, they will end up doing a biopsy, which is where they take a tissue sample and look at it under a microscope, and then that would give us the definitive answer whether or not those are cancerous cells. So treatment, typically this is surgical. We try to get rid of that lump, so that's called a lumpectomy. They may just remove that lump, that affected area, and then they may also receive a combination of chemotherapy and radiation to that area. Depending on how far along, what stage of breast cancer they're in, they may decide to go ahead and remove the entire breast. They may do a radical mastectomy, which is removal of the breast tissue, the muscle underneath, and the lymph nodes. That's pretty radical, like it says. Sometimes we can also, part of this chemotherapy treatment may be hormonal. Tamoxifen is a pretty common anti-estrogen medication, so we're just not giving that cancer any fuel to continue to proliferate. So some things that we need to do, this is very painful. I've seen some terrible wounds from breast cancer, and also the location of where it is. It can be really damaging to the self-esteem. So think about how this is making a female feel. You know, it's kind of like your womanhood is being taken away, especially if they end up with a mastectomy. It can be psychologically very difficult to get through. We also need to manage the effects of the chemotherapy, so the nausea, the vomiting, the hair loss, immunosuppression, all of those things that we've talked about before. And I may want to join a support group just because this is such a it's a common thing, but when it happens to you, you feel very alone. So support group can be very helpful. So there are some complications. Metastasis is the biggest worry. Since this is the second most common cause of cancer death in females, you know, we want to be able to catch this early and treat it early so it does not spread. If we do a radical mastectomy and removing muscle, that's going to affect mobility on that side. Of course, the pain. If we're removing lymph nodes, or if there's a lot of scar tissue that builds up and blocks those lymph nodes, then we need to be very careful that they don't develop lymphedema on that side. Lymphedema is very hard to treat, hard to get rid of, because there's nowhere for that lymph to go. So we need to make sure that they, you know, always tell everyone they can't have any tourniquets on that arm for blood draws. They can't have blood pressures taken on that arm because that could cause a backup of that lymph that we think have a really hard time getting rid of. We may also need to be careful with carrying heavy things on that arm, and they will learn how to do some exercises to try to increase that lymph flow, if there is any, to try to get rid of some of that lymph in that arm. And then, of course, the depression, especially if it's a radical mastectomy. Of course, they can do reconstructive surgery, but still we want to make sure that we're taking care of them, the whole person, psychologically, not just this breast cancer. So make sure you do your readings on this, and we'll discuss this a little bit more in class.